Hi, my name is Kristen Manzella. I am a nursing student at Bergen Community College, and I'm going to be doing my IV and my IV piggyback validation. First thing I'm going to do is check my physician's orders. I'm going to wash my hands, gather any equipment that I need. I'm going to enter the patient's room, introduce myself, check their identity with their identity band, ask them their name. I'm going to check for skin integrity at this point, any redness, swelling, inflammation of any kind. I'm going to make sure I check for privacy, and I'm going to tell the patient what exactly I'm going to be doing. I'm going to come back over, take my IV primary bag out, check the expiration, if there's any particles or sediments, any leakage of any kind. Next, I'm going to take out my IV tubing. I need to attach the tubing to my bag. I'm going to unplug the bag. I have to make sure everything is sterile to keep it that way. I'm going to take my spike cap off, put the spike into the bag. I'm going to hang my bag. Prime the chamber, halfway. Okay, I need to let the air out of the tubing. So what I'm going to do is unplug the bottom cap, make sure it's sterile, that it sits straight up. Okay, come over. Make sure this isn't locked. And make sure there's no air bubbles. Okay. Going to reattach the cap, and now I need to set the drip rate, which is 20 drops per minute. So I'm going to record it at 5 drops in a 15-second period. Okay. Wait. Okay. No, not yet. Okay, and go. So 1, 2, 3, 4, and 5. Okay, now that I've set the drip rate, I need to come over and I'm going to clean the port that I'm going to be putting it into. And then I would attach the tubing to my patient. At that point, I would put the call bell next to my patient, lower the bed all the way, and let them know if they need me to let me know. For validation purposes, I'm not going to be attaching it to the patient. Okay, I'd be leaving the room. Okay, next, the physician has ordered medication and IV piggyback for the patient. So once again, I'm going to check the physician's orders. Now, when it comes to medication, you need to check it 3 times. When you first get the medication against the physician's orders, when you're preparing it, and when you're administering the medication, you need to check them more with the physician's orders, and also ask the patient if they have any allergies. I'm going to come over and take out my bag once again. Get out my tubing, unplug my bag, same thing, take off my spike, make sure I do not touch it, put my spike in, I'm going to hang my bag. I need to prime this halfway. I need to lower my primary bag. Okay, and before I administer my medication, I need to double check the 6 rights, which is the right patient, the right drug, the right dose, the right time, the right route, and of course the right documentation. So next, I'm going to be attaching it to my primary tubing. Once again, I'm going to clean the port that it's going into. Uncap. Be very careful because that is sterile. And attach it to my line. And now, sometimes the drip rate will be different. It may be the same, but for validation, I'm going to make believe it's different, but I am still going to do it for 5 seconds and 5 drops in a 15-second period. Okay, so I need to open this, and I'm going to use the controller on my other tubing to do the drop rate drops again. So ready and go. So okay, we're gonna start over. Okay, ready and go. 1, 2, 3, 4, 5. Okay, so 5 drops. And when the medication is all done, if the drip rate was going to be going back to a different rate, I would need to readjust that. I would need to make sure that I put all labels on any of the tubing with the date, time, and my initials. The medication bag would have the solution, my initials, date, and time. And of course, once I were to take the medication, I would need to rehang the primary bag up to where it originally was. And again, when I were leaving the room, I would leave the call bell by the patient, lower the bed to the lowest position, and let them know if they need me to let me know. And also, before I'm all done, I also want to make sure that I wash my hands. That'll be the last thing that I do.